If you have any of these symptoms that we discussed in all of our shows, go reach out to your doctor. Your doctor is the right and the best person to give you advice and treatment. Again, these are information for your own benefit, but again, it helps you to seek the right treatment with your doctor.
Hello and welcome to Global Impact Life Enrichment Services. Thank you for choosing our channel and stopping by today. We are going to talk about something very important, our body. It is 2021 now, but the whole of 2021, almost the whole of 2020, we were on our couches at home with our families. We were trying to save the world and keep safe at the same time. But in that time, something happened that has affected or maybe caused some pains in our body, especially our lower backs. Today in the studios, I have with me Dr. Imrul Kabir. Thank you for being here, Doctor. He is going to discuss, he's a physical therapist by profession who serves the communities of Queens and Brooklyn, New York. And today he and we are going to discuss about this lower back pain and what is it, how is it caused, what are the remedies, what are the symptoms, and what is the point that you need to get up and get going. So without further ado, within a very short span of time, we are going to talk about and touch some very important points. So Dr. Kabir, once again, thank you for taking this time and being with us.
Thank you.
And my first question would be, how and what was your experience during this pandemic? You, as a profession, you are a physical therapist, and you have come across a lot of people during this time, during the pandemic. What were the major problems during the pandemic that people came with?
Thank you, Simon. It's a very time-appropriate question. You see, I'm working with the community here in Brooklyn and Queens, and a whole lot of our patients of many different age groups, they came with pain. A lot of pain. After the pandemic, after the lockdown, because they've been working from home, they've been studying from home, they've been confined at homes, they could not move much, and then many of them had to go through the COVID-19. They were affected, they were infected, and so again, they've been complaining of pain. And low back pain is the most common complaint that we've been hearing. Today, we're going to talk about low back pain, which is among the most common kind of pain, type of pain that we see among our patients and in America. So 80% of all adults will have low back pain at least once in their lifetime, right? And in America, we lose about 20 billion of revenues every single year because of patients who are becoming disabled due to chronic low back pain, or are not able to work or having days off due to low back pain, and that affects our economy directly or indirectly. So again, what is low back pain then? So if you look at this slide specifically, so we see the spine, the whole spine. The spine has 4 different areas: the neck, the cervical, or the upper back, the thoracic, the lower back, or the lumbar. So this is the area that we're going to talk about today, the pain in this area, and then the sacral or the tailbone. Now, the lumbar area has actually 5 bones, the L1, L2, L3, L4, and L5. And so today we're gonna specifically talk about pain in these areas. Yeah.
I saw that you said lumbar area. Can you once again take us to the last slide and show our viewers once again which area exactly is lumbar area?
So sure, yes. So basically, this is our spine. Our spine is made of many different bones. We call them vertebra, as you can see in this model. So we will talk about some of these conditions later on. But again, when you see that the vertebral bones are sitting on top of each other, that's how the spine is kind of made. And in the lumbar area, this is the area, there are 5 bones. Again, the bones are identified as L1, L2, L3, L4, and L5. So this pain in this area is called the lower back pain or the lumbar pain.
Lumbar pain. Okay.
Yes.
And what would be the common causes for this kind of lower back pain?
Very good question, Simon. Now, you see that it varies from person to person. During the pandemic, there were clients, there were patients who came with low back pain, and we could not pinpoint or identify the exact cause with those patients. Many of them were COVID-19 positive, right? And they were infected and they were bedridden and they were suffering from weeks or for months, right? And they would come with spine pain who eventually get better or recover fully. But again, there are other causes that we more commonly see in patients. These are disc problem. In this model or picture, you could see that the bones are sitting on top of each other. These are the vertebral body or the spinal bones. Again, the 5 of them makes the lumbar area. So this is the normal disc in this model. This is the normal disc again. This is the vertebral body. And again, the disc looks like this from top. This is our spinal cord, and these are the nerves. These nerves actually, they exit this point and they travel through our legs. We're going to see more pictures, more illustrations later on about that. So you would see that this is a normal disc. This is a disc that has degenerated, meaning that these are age-related changes. And then sometimes the disc would move out of its place. We call it disc bulging or herniation disc. And then we sometimes would see arthritic changes. These are arthritic changes. In this model, you would see that the bones have actually eroded, right? And you would see that the bones have, not only changed in shape compared to the normal spine, but also you would see new bones that has formed on the sides. We call them bone spurs. These are typical symptoms of or pictures in X-rays of spine that has been affected by arthritis. Okay, now, so these are the common causes. Again, disc herniation, sometimes it is postural, sometimes it is other neurological causes, sometimes it could be arthritis of the spine. So these are the common causes that we see in the clinic.
Now, as a professional, you can tell, when there's a certain kind of problems. But what are some of the tests that can be performed for diagnosis of such issues?
Right. Now, Simon, you would see that each patient has, even though they come with a common symptom of low back pain, but low back pain is a symptom of a disease. We have to identify the disease. To identify the disease, the first thing that we do is interview the patient. We take their history. We try to identify what causes the pain, what exacerbates the pain, what decreases the pain, what position makes them feel better. If there was an injury involved, it could be sports related, it could be car accident, it could be fall from the stairs, it could be work related injury even. A lot of the immigrants in America, again, they are involved with hard works. They are lifting, bending, twisting. Either it would be work at the restaurants or at Dunkin' Donut or construction or even driving cab for hours. They're sitting in a wrong posture hour after hour, day after day, months after months, year after year. So again, they would have issues with their spine, issues with their lower back, right? So then again, history is number one. A lot of times when patients come to me, I see that they're unable to answer a lot of questions clearly. So it is best for them when they're suffering from low back pain for a long time to keep kind of a journal or a diary and identify what causes the pain and what releases the pain, when was the last time they had same condition, and then what are the treatments that they're going through. Sometimes it's medications, sometimes maybe they had injections 1 or 2 years ago. Sometimes they have had physical therapy before. Some of them had surgery before. Some of them had an accident, for example, 15 years ago. So again, history is number one. Interview is number one that we do, the number one thing. Second is X-ray or MRI if needed. X-ray would usually give us a picture of the bone and the position of the spine. But again, it does not show us the nerve, the disc, and the other soft tissue structures. Soft tissue structures meaning the position of the disc or the nerve, if the nerve is compressed or impinged. So these are the things that usually come up in MRIs. So when we see that the X-ray report is either normal, but again the patient keeps complaining of the pain for long term, and then we would send the patient for MRI. And then sometimes there are other tests that we would do, like for example the nerve conduction test, which tells us if any of the nerves are blocked at the spine in this area. Sometimes they would have EMG that would also tell us if the leg muscles are involved due to again the nerve compression or injury at the spine.
And as of course pain is one of the symptoms, but what are some other symptoms?
Again, very good question. You see, sometimes pain is not the symptoms that they come to clinic with. Sometimes they would say that I have tingling sensation, I have burning sensation, I have pins and needle sensation, or I have numbness. I don't feel any sensation on my thigh, on the side of the leg, or on my big toe. So these are clear symptoms that these issues are actually related to the lumbar spine, and most probably the nerve is compressed or impinged. Then we try to identify those nerves. Again, the symptoms not necessarily always is pain. It can be tingling, it can be burning sensation, pins and needles, numbness, weakness. Sometimes even the patient would complain of difficulty urinating.
Oh, okay.
Yes, or sometimes the patient would limp and not be able to walk, right? So again, I would like to show this diagram actually. You would notice that just like a map of an area, of a zip code, different postal code, our body has a map. And this map actually tells us of the distribution of different nerves that comes out of our spine. So you would notice that in our head, in our arms, in our back, upper back, our lower back, and then our buttocks going to the thigh and leg, right? So again, if our lower back nerves are affected, you would notice that again the symptoms would come down to our leg. Again, our very lower end of the spine, again coming down to the buttocks and the back of the leg, right?
Okay.
So then again, by the distribution of the pain or the tingling or numbness, I'd be able to identify what specific nerve is affected. Based on that, we would formulate the treatment for that patient.
Wow. Wow. And in our discussion before, there was this term sciatica.
Right.
What is that? Can you elaborate on what is sciatica?
So, sciatica is sciatic nerve is the longest nerve of our body. I would like to show the diagram of our sciatic nerve. So this is the sciatic nerve. This is the longest nerve of our body. It originates from the spine. So what happens is that, as we can see here from this model, that the spinal cord again that connects our brain to our body, and then from the spinal cord comes out this nerve. These are the nerves that actually comes out of the spine and then goes down to our arms and our legs, right? So again, then these nerves they come together and they form a thick, long nerve. That is the sciatic nerve, right? So now, sciatic nerve can have pain, the distribution of the nerve, because of the compression here at the spine, or because of the compression here at the buttock. It can have compression again in two different sides. Now, here the buttocks, the cause of the compression is usually tightness of piriformis muscle. I know it's a strange name. So piriformis muscle is actually a very deep muscle inside our buttock. So this is the muscle where we sit. Now what happens is that for people who are carrying thick wallet on our back pocket and are sitting on the wallet for a long time, or people who are driving for a long time, what happens is that, or are leaning to one side while driving habitually, what happens is that you're giving a lot of pressure on your buttock.
Wow.
So what happens is that...
Did you hear that?
Yes. So that happens to a lot of people, and they cannot... So a lot of times, and to young people.
Of course.
Then again, we can identify that, of course, with a couple of tests in the clinic. But again, these patients, they suffer for years without knowing that they can actually get help, right? So again, so that is the reason why, dear audience, avoid carrying wallet, the fat wallet with a lot of money on your back pocket. So that's one thing. That's why it's called the fat wallet syndrome. That's the name of other sciatica. The other name of the sciatica. So now again, there are two different causes. One is from the disc and one is from the piriformis. So now, if it is from piriformis, we usually would stretch this muscle and that would release the sciatica. But again, if it is coming from the spine, like our topic today, low back pain, coming from the spine, then we have to treat the spine. We have to treat the nerve. We have to treat the disc, get the sciatica released. So this is sciatica that many of you have heard, talked about, getting treatment of, but very important to know again.
Wow. I'm getting rid of my wallet right after this interview. So, but thank you, doctor, for telling us about sciatica. Now, as you've told the problems, can you please elaborate also on the treatments? How would you treat it?
Yeah, now the treatment varies from person to person, patient to patient. You see, sometimes patients or a person who would have low back pain would, get help by just resting at home and putting hot pack on the back and putting a balm, for example, Bengay or Icy Hot, and then they'd be fine. They'd be ready to go back to work or school or to sports. And sometimes they would need medications. Sometimes it's the non-steroidal anti-inflammatory drug like ibuprofen, which is very helpful. Sometimes they would need medications for their sciatic pain like gabapentin. Sometimes they would need muscle relaxant like meloxicam. So again, the medication also varies based on the symptoms, and the doctor would be the best person to prescribe. Don't just go to a pharmacist and get a medication. Again, consult a doctor so the doctor can identify the cause of the problem and then prescribe you to the right medication. And then if the medication doesn't work, they would come to physical therapy. So a lot of times I would tell the patient, you see, medications are important, because a lot of physical therapists would say, oh, don't take medications, they have side effects. They do. But sometimes medications do help and are necessary. For example, when the disc has moved out of its place and there's a lot of local injury to the disc, to the nerve, and other soft tissue structures, then again, a medication like ibuprofen would help with the local inflammation, because again, ibuprofen is a non-steroidal anti-inflammatory drug. So when there's an anti-inflammatory medication taking care of the local inflammation, we, the physical therapists, can take off the rest of the conditions, the rest of the situation. We can then give them exercises to push the disc back to its place. We can help them strengthen their core muscles so they have a better posture. We can educate them on how to sit and drive, on how to position their desk when they're working for a long period of hours, in front of the computer, for example, the computer programmers, or how to sit at a desk for school children, for college students, for factory workers, or for many of my patients who are doing lifting, bending, twisting. They cannot change their job. So what we do, we tell them to modify their movements, modify their postures, limit the weight that they can lift. So there are so many things that we can educate them about: how to sleep, how to bend. So all these things. So even
everything matters.
Exactly,
all
exactly. It's a change of the lifestyle, I would say. Sometimes they are able to change their work, but a lot of times they do not have any option in life. Then again, we help them to modify their lifestyle.
Okay, doctor, I know that this might not even sound intellectual, but what are some things that we can do when we have no options? As you said, we have no options to change our lifestyle. So in that situation, what are some small little things that we can do to avoid something like this?
Right, a very good question, Simon, because I tell my patients, for example, even when the pain drops, I would not bend my spine to pick up that pen. Because even if I do not have low back pain, you know why? Because what we see, the symptoms, the bigger issues, it's the cumulative effects of little things that we do throughout the daytime, right? For example, you've been standing for too long, you've been bending, even though you're not lifting heavy things, but again, you're bending frequently. So again, these things do matter. And that is the reason why it's important that we follow a healthy lifestyle. And there are a couple of things that we can do. Yoga, again, helps. Frequent stretching helps. With the yoga, especially this posture, this is what we call McKenzie exercise when it comes to our physical therapy protocol. But again, with yoga, there's an asana where you actually bend backwards, right?
Okay.
That actually helps pushing the disc back to its place. So it actually helps with sciatica. It helps with a lot of your back problems. But again, if it increases your symptoms, if you feel that actually brings down the numbness, the tingling, whatever symptoms you're feeling down your leg, stop. Then you would be doing a different set of exercise that the physical therapist or the doctor will guide you to, right? And then again, this is another diagram that I always show to my patients. Again, don't lift anything heavy and bend backwards. Don't lift anything heavy and twist your spine. Again, never ever bend forward. You always have to bend your knees.
This I've seen before.
Exactly, never ever, even to pick up a pen. Again, bend your knees. Bend your knees or squat, okay? So again, don't lift anything heavy. If you need, use equipments to, again, use another help. So these are some of the things. So again, frequent twisting, bending, lifting, all these things matters. Even if you're not doing this for heavy work, but again, they have cumulative effects. So again, this you should avoid This is a good posture. So again, these are some of the ways to rest. Again, when you have extreme pain, and in this case, we're seeing an obese patient, but also with pregnant women, same situation. Okay. Again, they would complain of back pain a lot because of the extra weight that they're carrying, and their spine would have stress due to the extra weight. Okay. Then again, they would have a modified sleeping position and a modified sitting position. So it applies to other people as well, and the elderly as well.
Okay. That's very good information. I hope you got a shot of it, and also please make sure, whenever you're lifting something, or the way you're the way you're sleeping or sitting, everything matters. Thank you so much, Dr. Kabir, for coming out today and explaining such good information to us. Please stay tuned for our next episode, because we are going to discuss a very important issue, which is again very common among our community, whether it is South Asian community or any ethnicity that you belong to. But it is a very important issue that we all face, and Dr. Kabir is going to put some light on that issue. So thank you so much for joining us today, and I hope you check out our channel and you like and subscribe also, and we will see you in the next episode.
Thank you. If you have any of these symptoms that we discussed in all of our shows, go reach out to your doctor. Your doctor is the right and the best person to give you advice and treatment. Again, these are information for your own benefit, but again, it helps you to seek the right treatment with your doctor.